In the intense world of medical emergencies,
I'm worried that you punctured your right lung.
there's nothing more extreme than a code red.
He's been hit by that JCB vehicle there.
It means there's an immediate threat to life.
Any pulse? Can you just check?
No, I can't feel anything.
In the West Midlands, highly specialist teams are ready to react to these major traumas.
Patient's fallen from the top flight of the stairs.
By road
RET is about 2 minutes.
and air.
Patient has a large wound. Yeah, affirmative, all received.
These emergency doctors and specialist paramedics
I'm going to get you out, all right?
use cutting-edge trauma techniques and surgery normally only seen in operating theatres
John, there's some more very strong painkiller going in now.
to save people from almost certain death.
Celox, please, at major hemorrhage.
OK, stand clear. Shocking.
From car crashes
Rob, I'm just going to lift your feet. We're going to look at getting you out, OK?
to stabbings.
Gentleman has turned on Sean with a meat cleaver.
Filmed alongside the critical care teams,
If we'd have left it, your heart wouldn't have restarted.
we captured every vital second as these specialist crews work to save lives.
Let's get him on the ambulance.
Lift. Okay, nice and high.
Honestly, trust us.
Tonight,
Can you hear us, sir?
a man fights for his life after suffering a massive cardiac arrest at work.
Guys, his own respiratory effort is dropping off.
Where's that hurting, Faye?
Shoulder.
A show jumper is thrown head first off her horse.
So as she's come over that jump, the horse has landed, it's bucked. She's come down head first, hit the floor.
What is the chances of you cutting these branches so we can get the stretcher?
And a road traffic collision, car versus tree, leaves a woman with potentially severe injuries.
Now, Michelle, we want to lie you down on the stretcher. Ow!
It's early morning at base in Cosford, Shropshire,
Hey! How far have you got?
and critical care paramedics Sarah Folley and Faye Pollock from the Midlands Air Ambulance charity are prepping their emergency vehicle for a 12-hour shift.
Come on, let's do this. Glamorous job, Faye.
Sarah and Faye need to be prepared to deal with any critical emergency across the region, and they're no strangers to working as a team.
Faye and I started as training as paramedics on the same day when we were 18. So we've done a lot of this, a lot of washing cars.
That was only a couple of years ago, of course, those days, wasn't it?
Yeah. I think both of us, we've always loved this job because you never know what your day will bring. There we go. Right.
Ambulance service, is the patient breathing?
Could I have an ambulance, please?
Is the patient currently breathing?
It's gasping for breath.
Okay, is he conscious and awake?
No. I know he's been having chest problems. It's like he's having an heart attack. He's stopped breathing.
It's a busy old road.
A man has collapsed at work with a suspected cardiac arrest. It's a Category 1 emergency, the most serious kind.
64-year-old male, unconscious.
First aiders are already on scene battling to keep the patient alive.
This is a public place, a floor company.
An ambulance is on its way, and Faye and Sarah have been called for their advanced life-saving skills.
Collapsed unconscious, gasping for breath, going blue, having chest pain. So breathing gone to get a defib, first aider doing CPR, defib in use.
It's a cardiac arrest.
During cardiac arrest, the heart stops beating, leaving critical organs starved of oxygen.
Thank you, thank you, thank you.
As this patient's life hangs in the balance, the critical care team need to urgently get to the scene.
There should be a right turning just up, that'll get you access, and then it'll be the first right to the industrial station.
Roger, that's all received. We've got them in sight. Thanks, Matt.
Roger, thank you.
I'll grab the Lucas. Hello, ladies. How you doing? You alright?
The patient, 64-year-old David, was at work when he collapsed. The first aiders on the scene immediately performed CPR and used an automatic defibrillator which can deliver a shock to the heart.
Hello, can you hear us, sir? Is he in arrest or...?
No,
that's good.
We rock.
Okay.
A ROSC, or return of spontaneous circulation, means that David's heart has restarted. It's a good sign, but he could go back into cardiac arrest at any moment.
So 4 rounds of CPR, non-shockable throughout.
Right. We got here active breathing. He did have a pulse. He is breathing for himself when I first checked.
He is indeed.
1 in 3 patients who come out of cardiac arrest go on to have another. Faye and Sarah's priority now is to stop this happening to David.
Is your eye gels, are they in here? Do you know?
Yes.
Is that eye gels?
When the body is starved of oxygen, the risks of catastrophic brain injury increase massively.
I'll have a look at the connection.
So the team inserts an eye gel, a mask and tube which allows oxygen to be pumped straight into his airways.
Oh no, I'm sorry, sir. A little bit uncomfortable for just a second.
Every second counts. In the UK, less than 1 in 10 people survive an out-of-hospital cardiac arrest.
Faye, what can we do? Talk to us.
Hi, Judy.
Ambulance services to patient breathing.
Yes, patient's breathing.
And what's the reason for the call, sorry?
Car accident. Car's gone off the road, hit a tree. There's 1 passenger, there's been a shock at the front.
Your neck.
Your neck? Okay.
Is she trapped in the vehicle?
Yes. She can't get out the vehicle.
Is she able to give you a date of birth?
What's your date of birth, Michelle? Can you remember? She can't remember.
She can't remember.
It's okay, darling. It's okay.
But we have got that help arranged, okay, and we will be coming as quickly as we can.
7067 on channel.
Critical care paramedics Kerry Hemus and Laura Taylor are immediately dispatched.
Apparently it's a road traffic collision. There is a crew that's just arrived on scene, so we're going to get an update hopefully soon as to the sort of condition of the patient.
An ambulance is already at the site of the crash, but there's a chance that the woman may have suffered brain or spinal damage. To give her the best possible on-scene assessment, critical care backup is needed.
Single vehicle, first is a 4 and 3. Debris across the road, seriously broken glass across the floor. 51, 50-year-old female, complaining of neck pain.
Neck pain, resulting from such a forceful impact, could at worst be a sign of fracture, which can leave patients paralysed.
Grab your helmet as well, just in case.
When the critical care team arrive, the ambulance crew are assessing the patient, 52-year-old Michelle.
Can we go over and get a bit of a clinical handover?
Meanwhile, the fire service are trying to work out how to get her out of the vehicle.
Hi, guys. Do you know what her name
The
is?
patient's husband, Michael, has walked away from the crash unhurt, but passenger Michelle has taken the full force of the impact.
Hiya, I'm Laura, got Kerry with me.
Hiya.
Hi, who've we got here?
Michelle.
Hi Michelle, my name's Laura, I'm just from the air ambulance.
What
okay?
clinically have you got? What clinical
How's she
picture
doing?
have you got?
So she's tachyhypertensive. So she's able to move her legs. She's got no new pain there. Just have pain from an ulcer anyway. All we can find at the minute is central C-spine tenderness.
Although Michelle's heart rate is high, Kerry and Laura's priority is to assess her neck and spine for any indications of more serious damage.
And the pain, is it quite sort of spinal or is it to the side?
Yes. So on palpation it is central.
Okay.
It's paramount the team don't make any injuries she may have sustained worse. They need to decide the best way to get Michelle out of the car at the same time as supporting her neck.
So in terms of extrication, what I'm thinking is if she's moving all of her limbs, that we get her to self-extricate, but we do it really gently. And we could probably do it now if we can move some more of these branches.
So what they're going to do is they're going to make a route as best they can.
Okay, that's perfect, because to be fair, it'll just be this bit here so we can get the bed. And then, because I just think getting the roof off isn't going to achieve anything, I don't think. No. Because we're not going to lift her up and out of the car. I think by asking us to step out and turn and sit is going to be less stress on her to stand and turn and sit. Okay.
Kerry decides that the best way of getting Michelle out of the car is to ask her to try and move herself away from the wreckage. But as the full extent of her injuries are yet unknown, Kerry and Laura need to be on high alert.
If we can get just as much of a clear path so the bed can get up, that would be perfect.
At base in Worcester, critical care paramedics Will Meadows and Grant Soulsby are starting their 12-hour car shift.
Oh, what did you do for a while, mate?
It's been a bit of time, mate. I can't remember when the last shift was.
Quite a while ago. You've been booking your shifts off when you see it's with me, is that what it is?
Yeah, how to avoid a shift before.
Every shift brings new challenges for the critical care teams, and there's no such thing as a typical day.
Cool.
Strapped in, all good to go.
It's not long before they are dispatched to an urgent 999 call.
So we've been sent to a horse rider that's apparently come off the horse and they're unconscious with some chest injuries, but details are quite limited.
Being thrown from a horse can result in very serious injuries, so the team's specialist trauma skills could prove crucial.
Yeah, hi Southwest, mobile to this case, our ETA should be approximately 8 to 9 minutes in. Details passed, horse rider unconscious with chest injuries, is that correct? Cool.
That's not good.
It's not sounding good.
The patient's injuries could indicate internal organ damage, which although invisible, can be life-threatening.
So it's just to put on the left apparently, Will. Anywhere here.
Chucks it.
An ambulance crew is already on scene.
Red Bag and Lucas then, mate?
Yeah, sure. Hello.
Oh yeah, how you doing? I'm Grant, this is Will. Who's this?
This is Faye, she's 21.
Hey Faye.
Been on the floor for an hour now after falling off her horse. She's fallen off and she's got pain in her right shoulder. She's been conscious and breathing throughout.
About an hour ago this was?
Yeah.
Blimey, okay.
21-year-old international show jumper Faye was enjoying a training session with her horse when it kicked her off over a jump.
Shall we? Just a thought. Over an hour ago, she seems relatively stable. Should we get you out of this cold? Yeah?
Yeah.
But before she can be moved, the team need to check for any broken bones.
She's got pain.
Yeah,
Here?
right, so yeah.
Okay, so you're just going to press in your chest.
Meanwhile, Grant finds out as much as he can about the accident from an eyewitness, Faye's partner Lee.
Just go through the mechanism of what happened then.
So as she's come over that jump there, the horse has landed, it's bucked, dropped its head onto the right, and as she's twisted, she's come down head first, hit the floor,
okay,
and her shoulder, spun, and then the horse sort of pulled her from there to here. This is where she's landed.
Faye is currently only complaining of right shoulder pain, but having hit the floor head first, she may have sustained injuries that have life-changing consequences.
Are you able to actually move your legs? You can move your feet. Can you rotate them at all?
Really painful.
Reoxygenate.
In Brierley Hill,
Just so we're all on the same page, so we're happy with the airway with an eye gel in.
critical care paramedics Faye and Sarah are treating 64-year-old David, who suffered a cardiac arrest whilst at work.
Any further treatment we'll do on the ambulance, and then we'll go from there if that's all right, okay?
Ah, well done, ladies. Perfect.
Happy? Yeah.
The team has got David's heart started again, but there's a risk he could re-arrest at any moment.
Thank you.
Now the challenge is getting him to hospital without this happening.
Guys, his own respiratory effort is dropping off.
But as they're getting ready to leave, David's oxygen saturation levels take a sudden drop, and he stops breathing again.
He's going to have to get tubed, isn't he?
I'll squeeze the bag if he needs it, because then tidal's going up, so.
Faye inserts an endotracheal tube into his windpipe, and slowly David's oxygen levels start to improve.
CO2 of 5, SATs of 100%. What's the ETA for New Cross?
Yeah, start
20 minutes.
With his oxygen levels rising, David starts to breathe for himself again. But because he is more conscious, he starts to become increasingly agitated.
Just check that with you, midazolam, and it's 2024.
Sarah and Faye must act quickly to ensure that the tube delivering oxygen to his body is kept in place, so they give him midazolam. This high-strength drug should relax David and allow enough oxygen to circulate around his body, essential to keep him alive.
There's just a little bit more sedation here.
But David is still breathing too quickly for the tube to be effective.
I'm thinking that we could potentially paralyse him, because we've got a long journey up to New Cross.
Yeah.
Rocky Ronium 2023. Happy?
Yes.
Okay, happy to give it?
Yeah.
And then
The only option is for Sarah to administer rocuronium, a fast-acting muscle relaxant normally used in operating theatres before major surgery. This will allow the team to control his airway and breathing rate.
Happy?
Yes.
Okay, so volume 1136, 50 milligrams of rocuronium going in. Because the gentleman's starting to regain consciousness, we're having to keep him quite heavily sedated with drugs to allow the airway to stay in. So we've just given him a drug which will paralyse him, and it will actually stop him from breathing. So the rock should be working. Temperature's okay-ish. I'll get another of our blankets on. It's now quite important, because we've paralysed this gentleman. We have to take over all the jobs that his body would normally do, such as keeping warm. So we're popping the heater on. We're going to pop a lot of blankets on him. His temperature at the moment is okay, but we just don't want him, because he can't shiver anymore. We don't want him getting cold.
It's critical that Faye and Sarah monitor David's vital signs closely.
By taking over his respiratory rate on the tube and the ventilator, we can try and get all these numbers to numbers that we want, that are better for the body. So at the moment we want to bring his carbon dioxide levels down, and we're trying to do that by increasing his respiratory rate on the ventilator.
Although still in a very precarious position, David seems to be responding well.
He doesn't need any more fluid, does he? He's got a good enough blood pressure. He's actually quite a good colour. He's quite perfused, and he's really quite, and his pupils are equal and reactive. He's certainly more comfortable.
Just over an hour after the 999 call, David is handed over to the cardiac team at New Cross Hospital, where they are ready to take him immediately into their care.
He's in the best place. We've brought him to a cardiac centre, so we can take him straight to theatres if required.
In rural Worcestershire,
What is the chances of you cutting those two so we can get the stretcher?
Do that now for you.
critical care paramedics Kerry Hemus and Laura Taylor are attending a serious road collision. A car has hit a fallen tree and spun off the road.
If we get this bit cleared, I think priority would be getting this bit cleared and getting this road here clear because our bed is in the ambulance there.
The extent of 52-year-old Michelle's injuries are as yet unknown, but Kerry and Laura can't assess her fully until she's out of the car.
So Michelle, what we're doing for you now is we're just going to get our trolley bed for you, okay? And then we're going to see if we can get you actually just to get yourself out of the car, okay? Where's your pain at the moment?
Back of the head.
Back of your head?
Coccyx.
Your coccyx, okay.
With pain in both her head, neck and coccyx, Michelle may have sustained serious injuries.
We're going to, oh, here we go. So the bed's here now. So what we're going to do is just get it ready for you, and then what we'll do is just see if we can get you to turn and get yourself out, okay? Because it's the most protective way to protect your neck, because your body kind of naturally, the muscles around your spinal cord kind of protect itself, okay?
Laura decides the best way to get Michelle out is to ask her to move herself out of the wreckage and onto a stretcher.
Let's look after you now then. So we've got our bed here for you, Michelle.
Moving a patient with potential neck and back injuries must be carried out as carefully as possible to avoid worsening symptoms.
Right, have you got shoes on? You've got slippers, that's all right, that'll protect your feet. So what we want you to do is just sit forward if you can, turn around, and then we're just going to sit you onto this bed, okay?
And do you think you could bring your legs out the car as you would normally? Okay, there we go. Oh. No, just be careful, because as you come out, you're going to have to duck a little bit. Okay? How are we doing? Just sit for a second, get your bearings, keep your head nice and still for me. That's it. Right, when you're ready, Michelle, can we get you to stand? Okay.
For either side of you. So
you let us know and we can help support you. Well done. Oh, well done, well done. Just stand for a second, get your bearings. You're doing amazing. Okay? How are you feeling now you stood? Have you gone dizzy or anything, or are you okay?
Swimming.
What to do with a vodka and Red Bull?
I don't think that would help this situation, bless you.
The extrication plan has worked so far, but now the team need to get Michelle into the ambulance and get her some much-needed pain relief.
Right, what we want to do, Michelle, we need to turn around so you're facing the other way, so your back's to that bed. Keep your head nice and still for me. Just do a little turn.
I'm here for you as well.
That's it, well done. Keep your head nice and straight for us, Michelle.
I'm here if you need me.
The team ensure her head and neck are well supported and held straight at all times.
That's it, well done. Now sit yourself on the bed to start with. Hold on. You all right?
Yeah. But for Michelle, the pain is excruciating.
Okay. Oh. Now, Michelle, we want to lie you down on this stretcher. Nice and steady.
You could feel my fingers. Okay.
In rural Gloucestershire,
What about this left side?
critical care paramedics Grant Salisbury and Will Meadows are assisting paramedics treating international show jumper Faye after she was thrown head first from her horse.
Okay.
So any massive concerns?
Right thoracic pain, right back here. Soft to palpate all over abdo.
Yeah.
But pain all over the region of it.
But an hour in, we're quite stable with obs. There's nothing
fine.
gross that you've noticed.
Nothing.
Moving all four limbs.
Yep.
Should we keep you warm? I'm just going to put these coats back over you for a sec, all right, yeah?
Abdominal pain could indicate damage to Faye's bowel or liver. She needs to get onto the ambulance fast.
It's not the best terrain, this, is it?
But moving her across the rough ground isn't going to be easy.
I think your crewmate is doing the Entonox. Is she all right for Entonox, do you think?
Yeah, do you feel at the moment with the pain that you've got in your chest, because it is thoracic chest pain, worse on inhalation, so we'll see if it is okay for you to take some gas and air. Do you feel you need pain relief at the moment while we move you? Yeah?
The team want to give Faye gas and air, commonly used in childbirth, for speedy pain relief.
Have you just had the one BP, or is...
Yeah, that was the first one. Yeah.
Should we get another BP, just because that's a little bit higher now?
Before it's administered, Will needs to make sure her vital readings are stable.
And Sats are all right, you said? Good.
Yeah.
Yeah. Do you think you were knocked out at all?
I don't know.
Or just had the wind taken out of you?
I can't remember.
Will performs a second blood pressure test.
Right, so that blood pressure's just running. Like you said, 101, that's cool.
If you pop that in your mouth and just take a deep breath in.
Faye, we are going to have to pull away these coats, mate. You're going to be cold for a little bit whilst we just get you transferred onto that bed. And then we'll get you wrapped up with the heating on and get you warm, OK? That's the priority at the moment, get you warm, OK? Rose is just going to support your head, Faye, and hold it nice and still. And then I'm just going to peel that helmet off. All right. OK, you got it?
Yep, got. Lovely.
Will now removes Faye's helmet to check for any head injuries.
Right, any pain where I'm pressing there, Faye?
Yeah.
Yeah?
Oh, it's tender, yeah.
It's tender, OK.
With no obvious signs of head trauma, they're now clear to get Faye onto the stretcher safely.
Are we able to take off this gilet? We're going to cut it, Faye, OK? Nice and slowly there, Faye. Sorry, mate, is that hurting? Where's that hurting, Faye?
Shoulder.
In your shoulder?
Yeah, that
okay.
shoulder was injured.
All right. What I want you to do, Faye, is hold this wrist with the hand there.
So, Faye, we're going to roll you towards us over here. Me and Kirsty, all right?
Ready, steady, roll.
Right, OK, good.
Okay, ready, steady, lower.
Perfect. Well done, guys.
Now Faye is ready to be moved, but the short distance to the ambulance could be excruciating.
Did you want any more of that Entonox, Faye? Or you?
Please.
Yeah, OK. OK, you take... You got it? Good stuff. All right, you look after that. You push, I pull.
This is probably the most uncomfortable bit, Faye. You're doing really, really well.
Nice and steady, mate, nice and steady.
Faye, can we connect the blood pressure cuff to your arm again? You're looking really well, which is good.
Before Grant hands Faye over to the ambulance crew, he needs to perform a full assessment.
So pain score 0 to 10 at the moment. 0 is nothing, and 10 is the worst pain in the world that you could ever imagine. What number are you at the moment? 6. And where is that?
Pretty much down back of my room.
How's that?
Not too bad.
Nice. I just can't see you, which is good. Okay. Front of your chest.
Like sore.
Sore there. To side.
Sore.
And this side.
Like tender but not bad.
Quick prod of your belly. All okay there? Sore just all over. Just sore everywhere, isn't it? And legs okay. Feet, move your feet again for us. Awesome, there we go. Open your mouth, close your mouth. Big smile, open your mouth again, stick your tongue out. Blow raspberry. Okay. Right, Faye, it's been a traumatic couple of hours for you. We're gonna try and make it less traumatic and bugger off and leave you with these lovely people. Is that okay? Any questions before we go?
All good.
Okay. You guys all good?
Oh, yeah.
Right, see you then. Good to see you.
Bye-bye. Safe journey.
Faye's injuries need a thorough hospital assessment, but for now the critical care paramedics' job is done, and the ambulance crew can now take her to Gloucester Hospital, where she can be handed over directly to the emergency department. In Worcestershire,
That's fantastic.
critical care paramedics Kerry Hemus and Laura Taylor have just got 52-year-old Michelle out of her car after she crashed into a fallen tree.
Could we get a blanket for under her head?
She's complaining of neck and back pain and could have sustained severe muscular injuries.
Let's fold this one because I think she needs just a little bit of padding under her head.
It's right here. Here we go. Yeah, what was your name, sorry?
Yes,
Michael. Lovely. Michael and Michelle. That's easy, isn't it? We're just making her a little bit more comfortable. We'll get her on the ambulance into the warm, okay?
Right, ready when you are then.
Although she's now safely away from the wreckage, the team need to make sure Michelle stays still and straight to avoid making her injuries any worse.
Thank you, everyone.
So, your main pain, Michelle, You say it's kind of in the bottom of your head, top of your neck, and then in your coccyx, is that correct? Okay. And how bad is that pain if you were to score it out of 10? 1 being no pain, 10 being eaten by a lion.
Probably a 5.
About a 5. Do you feel short of breath?
I'm asthmatic anyway, but...
You are asthmatic, are you? How does your breathing feel?
It's tight, but it's alright.
It feels a bit tight. Okay.
We'll go with the Entonox.
With the news that Michelle suffers from asthma, a condition that can worsen with anxiety and stress, Kerry needs to relax her so that she doesn't move too much and exacerbate her injuries.
You didn't expect to be going to hospital tonight, did you, Michelle? Have you had gas and air before, Michelle?
No, I don't think so.
It'll make you feel a bit woozy, like you've had a few drinks. You did say you wanted a vodka Red Bull, didn't you? So it'll make you feel like you've had one of them. And then as soon as you stop taking it, it'll stop working, all right? So just nice, steady breaths, nice and sort of slowly. Breathe it in as you breathe in and then just breathe it out. He's just outside the ambulance because he wants to come and say bye to you before you go. Does he? Oh, Michelle, don't get upset, sweetie. All right, you start taking this gas and air then for me.
I'll go get him.
I'll go with her or?
She's asking for you.
Mike. Mike.
All right? Right, Michelle, all the best, all right? Take care. Are you feeling a bit woozy? All right?
Thank you.
You're welcome. Get well soon, all right? Okay?
Thank you so much.
You're welcome. Anyway, take care.
With her husband on board, Kerry and Laura leave Michelle in the care of the ambulance crew, who'll take her to hospital to be fully checked over.
We obviously wanted to be careful with her neck, but in a situation like this, it's much better for the patient to actually step out of the vehicle if they're able to, which Michelle was able to, thankfully. And I think all her observations were fine, which is why we were happy to let her stand out. And then she's gone off to Worcester for some care and some pain relief.
Services, the patient breathing.
I've just heard a big bang outside. I've come outside and my next door neighbour's fell off his ladder, off his roof. He's on the floor.
Okay, is he breathing?
He's breathing, but he's got bad chest pains and all down his right arm.
How far did he fall, would you say?
It's about 3 metres high.
About 3 metres,
He's
yeah.
just slipped. Yeah, he's gasping and he seems to be in a lot of pain, yeah. Can't move at all.
Yeah, okay, clear left.
A paramedic and ambulance car is already on scene. Critical care paramedics Rob Davies and Liam Webb have also been dispatched. They're updated en route.
We have been sent to a job where there's reports of a male, I think he's in his 50s, who's fallen off a ladder. Could be sort of head injuries, limb fractures, and everything in between, essentially.
Cabin crew has fallen from a ladder, approximately 12 foot high, stood at the top of the ladder. The seat has slipped backwards, so he has landed on his front, complaining of chest and breathing difficulty. He is conscious over.
That's all received, thank you. ETA, about 8 minutes.
Breathing difficulties after such a major fall could indicate lung damage and needs immediate treatment.
Amazing, thank you. Where are we?
Through there, through the open gate.
Okay, thank you. Hello. Hey, mate. Hello.
The patient, who's now lying on his back, is 56-year-old Mike, a retired firefighter.
Was you actually on the
I was on the ladder, right, head high, and the head was in line with the gutter.
Yeah.
And it just like went along the back, straight, flat, pancake style.
Yeah.
And then obviously all this here is like probably landed on the ladder.
Yes, okay.
I just felt my ribs straight away. And then
Fine,
shoulder.
Slipped off. Were you here on your own when it happened?
Yeah.
So do you think you knocked out at all? Do you remember everything about it?
Pretty much, yeah. I was getting leaves out.
Right.
And it just didn't even know it went, you know what I mean? Just went dead quick.
Okay. And pain-wise at the moment, you're talking about ribs on this right side?
All the shoulder, around this neck here. Can't even move here.
Taking the full force of the impact on his chest, Mike could have sustained serious injuries, such as broken ribs and internal bleeds.
Let's have a quick feel around. Okay, so just going to go around the back of your head. Any pain on your head or anything like that?
No.
Back of your neck, just there in the centre?
It's on the right-hand side.
Okay, I'm not going to squeeze too hard. Between your shoulders there. Collarbones here, I just got my thumbs on there. How does that feel? Tender?
Tender on this side, yeah.
Okay. Shoulder, tight on this on the right side.
Mike's chest is very painful, a sign that he could have fractured some ribs as suspected.
Just in your chest, can you take a breath for me?
Oh, God, that hurts.
And on this right side?
All down that side,
okay.
This could lead to pneumothorax, where the broken rib tears into the lung. In some cases, resulting in serious respiratory problems.
Covered up, mate.
In Staffordshire.
Okay, so that's painful in your tummy there.
Critical care paramedics Rob Davies and Liam Webb are assessing 56-year-old ex-firefighter Mike, who fell 3 metres from a ladder whilst clearing his gutter.
Hips feel okay?
A little bit tender on that.
He appears to have sustained trauma to his chest and shoulder, but Rob and Liam need to make sure there aren't any other hidden injuries.
Can you lift your legs independently? So, like, can you lift your left leg on your own? Yeah, lift your right leg. Can you lift that straight leg? Raise that. Great.
Mike is able to move all 4 limbs and is conscious and alert, but he may have fractured some ribs, which could result in internal bleeding or a punctured lung.
So what we'll do, Mike, we're going to get some observations on you. We're going to get some access into your arm. We'll give you some pain relief.
Mike urgently needs assessment in hospital, so an ambulance is called.
What are the injuries we got?
So, right-sided really, so he's got pain, right shoulder, right ribs. I'm not really worried about sort of pelvis or anything like that. Can you bring your arm out of there, Mike? Is that possible? So that one will come out and then we'll cut the other one.
There we go.
Where's that hurt?
Now Rob and Liam need to get Mike's pain under control.
Well, on that right side, Mike, yeah? Shoulder?
Yes. Oh.
Is that more comfortable there?
Oh. All here. Oh.
Okay, let's have that arm back, mate.
And the ribs.
Yeah.
I'm just going to cut your top, I think.
Yeah, for the sake of it, we're not going to roll you around.
Oh.
The team need to administer pain relief intravenously and get the best access they can to his chest to assess his injuries.
Is that painful here?
Yeah.
What about here?
Everywhere, all the whole
Doesn't seem to be
area.
on. Sounds like he's come fairly hard down on that side. Just going to go tight in your arm, Mike, okay? Beautiful. Cheers, mate. Hello. So, Mike, that's a crew just arriving. All right. What we're going to do is we're going to pop you on a scoop stretcher. You know what that is?
Yeah.
Wrap you up the wall.
Rob briefs the paramedics who'll be taking him to hospital.
So, this is Mike. He's gone down hard on his right side. Don't think there's a loss of consciousness. Injury-wise, head seems okay. He's complaining of pain in right shoulder, quite tender, all down that side. He's got equal rise and fall on the chest. Haven't listened to it yet, but he's moving air and he doesn't seem overly short of breath. Liam's getting some access. We'll give him some pain relief. So I think from where we are, we'll scoop him blocks and then up and onto yours there, yeah? Happy? Sound.
Sharp scratch.
Liam prepares to administer morphine intravenously. It's an opioid used to treat severe pain.
So what I'm going to do in a sec, we're giving you some morphine, mate, all right? Okay? And then what we're going to do, just going to get a couple of people, you're used to all of this.
Yeah.
We're just going to roll you very gently, just a tiny little roll, just to get the stretcher underneath you. I'm probably going to leave this cushion under your head, just to give you a little bit of support under your head.
Okay.
All right? And then, well...
Shaking that mad.
Yeah, you're cold, mate.
I'm sure it is. Is the heating on in the ambulance?
Yeah.
Perfect.
So, team, if we can get in position then with a few hands on just to give him a little roll. Yeah, we'll go out that way first,
Try and help you.
No, you don't want to. No, you just let us do it, mate, all right.
This ex-firefighter is used to helping out, but any movement could make his condition worse. Rob and Liam need him to stay still.
Just let your legs relax down.
So we'll go on with the clothes and then we can bring it off after.
Relax. Right. We'll move you. Okay. Yeah. Makes our life a lot easier.
Mike, just hold still, hold still. Is everybody ready? And we'll just go for a little roll up. Ready, set and roll.
There we go, keep going.
That's it, just sit there like that for us. And then when we're ready to lift him, team, shall we lift and then just bring the trolley in underneath rather than wandering across? Everybody ready? Yep. Ready, set and lift.
Okay, we on?
Yeah, needs to come down a bit because he's tall. There we are, perfect.
Okay, cool.
Safely on the stretcher, the team move Mike to the warmth of the ambulance.
All right, team. Thank you. So, how do you feel now? You've had a little bit of pain relief.
Oh, still in pain.
It's pain?
Yeah.
Is it painful when you breathe?
If I breathe deeply, yeah, the ribs.
So if you take smaller breaths as you are, that's a bit more comfortable, yeah? Brilliant.
Mike's continuing pain could be a sign of internal bleeding. The team check his vital signs.
Have we had a listen to his chest now?
I haven't, mate, no.
Shall I do that?
Yeah, have a listen to his chest. I'm just going to pop this on. Just undo your arms for us, Mike. Thank you. Just going to get some observations on and just have a little look. All right. Got a lovely radial on there. Sound.
Mike's pulse and blood pressure don't ring any alarm bells.
Where's that mainly hurting? Your shoulder? Up here?
But on checking, it's clear they need to keep his blood oxygen levels from falling any lower.
Mike, just going to pop an oxygen mask over, just take a few deep breaths of that. All right.
They use an oxygen mask to bring the levels up and reassess Mike's pain medication.
So he's had 5 of morphine. I don't know if it's really hit the sides of it, has it?
Yeah, so you could certainly have another 5,
yeah.
10 in.
Should we do that in a gram of paracetamol? Yeah. He's had some ibuprofen before he calls, but yeah, if we can get another 5 of morphine, is that right?
Happy that Mike is stable, Rob and Liam can leave him in the care of the ambulance crew.
So I think that's as much as we can do for you. You guys happy with that? Yeah. With the rest of it? Yeah, no. Mike? Yeah. So we're going to leave you with this team. They're going to pop you up to Stoke, all right? No worries, take care. Yeah, and...
Fingers crossed for the pay rise.
Yeah, for us all, yeah. Potentially, I think he's probably got a right shoulder injury and some rib injuries on that side. Got a bit of difficulty in breathing. And he's off to Stoke, off to the hospital. With some treatment, he should make a good recovery.